Jill, we're live. How are you?
Good. How are you doing, Ryan?
I'm great. I'm great. Happy Thursday to you.
Yes, happy Thursday. Almost Friday.
That's right.
Almost the weekend.
We've got about a minute before we get started here. Before we get the top of the hour.
Oh, good. We're close. So for those of you who are joining right now, feel free to type in your name. Just say hello at the bottom right-hand side, just so that we know that you're here. I think, Ryan, you can see everybody jumping in on the call.
Yep.
All right, good. Looks like it's sunny where you're at, Ryan.
It's nice, yeah.
Same here until the polar vortex hits.
Yeah.
Later tonight. Right. Kind of crazy. Don't expect that in May. Are we ready to go already?
Yeah, let's do it. We can go ahead and get started.
All right, awesome. So good afternoon, everybody. Thank you so much for joining us. Ryan and I are really excited to be doing this on kind of a new type of platform on Webinar Live and also YouTube Live. And quite frankly, it's been a while since we've seen some of you at some of the conventions in your offices. So unfortunately, we can't see you, but you're stuck seeing us. But we can at least see your names popping up, which is kind of nice. And that gives us a little bit of comfort knowing that you're out there. So feel free to say hi on the bottom there on the right-hand side. There's also those cute little emojis if you're watching this on Facebook. There's that cute little care emoji that just came out last week. So feel free to use that. And what we'd also love to do is, and Ryan, I think we talked about this, if you have like a great idea to share, something that you've done to communicate with your patients to show that you care for them and that you're helping them along through this kind of challenging time. You know, I know some practices are, calling their patients personally and talking to them. Others are doing some fun things on Facebook. Feel free to share some of the ideas that you've had, and we will randomly choose a winner at the end of this webinar. Who will receive a $100 Amazon gift card, which I think everybody can use these days. And I think when the last time we did this, somebody had some great ideas. They were actually taking pictures of themselves with their patients that are 100 years old. I think it was even through telemedicine or something like that. I don't even know if they were together at the time, but kind of a fun thing to place onto Facebook. All right, so when this all began like 8 weeks ago, I thought no problem. We're going to shelter in place for a good 8 to 12 weeks. And then on June 1st or so, we're just going to flip a switch and life is going to be back to normal. Probably around week 3 or so. I don't know when it hit you, Ryan, but probably around week 3 for me, I realized there is no switch.
That's right.
And we really need to plan for a new normal. Most of the practices that I'm talking to these days, they're seeing probably about 10% of their normal volume of patients. And as states are opening up and practices are starting to open up over the next few weeks, they're really starting at about 25% of their normal patient volume. So I really think that over time, it's going to take a while for practices to really be at full capacity. I'd say probably, within 6 months, practices are going to be pretty lucky if they're at 50 to 75%. And in a year, hopefully everybody will be back up at 100%. Although I think the news this week has not been so good. I'm hearing that this is going to be kind of long-term 2 plus maybe 3 years, which I'm hoping, quite frankly, that they're super wrong on that.
Yeah.
So that's the whole reason why this whole topic of restarting your practice with an effective patient communication plan is so incredibly important, because patients are really nervous right now. So that communication plan is going to bring patients back in the door. So could we start with introductions, Ryan?
Yeah, let's do it.
So some of you on the call already know who I am. I'm Jill Maher. I'm the business consultant with Maher Medical Practice Consulting. And I basically work with practices on anything dealing with practice management, strategic planning, marketing. And then also a big part of my business is really recruiting for physicians, ophthalmologists, optometrists, administrators, to really bring some more efficiency to practices. So Ryan, you?
Yeah, Ryan Schumacher, satisfied patient. We help practices get actionable feedback internally from their patients and positive online reviews to help grow. We also provide a little bit of differentiation in the marketplace. We provide insights reports, allowing you to kind of keep your finger on the pulse of your patient feedback that directly impacts your revenue.
All right, very good. So as you're getting the presentation put up, I don't know if it's up on your end, I'll just share a quick little story with you. And that's something that happened to my husband about a week ago Sunday. After 21 years of marriage, he decided to take up cooking. Takes a pandemic to get my husband to cook. And I could hear him in the kitchen. I was not in here. I heard him in the kitchen. He's slicing away at something. And all of a sudden I heard a little squeal and realized that something was probably not right. So I came running in, and of course he had cut his thumb. And it took about 15 minutes of him being pretty upset. And I finally took a look at it and said, we've got to get you to, urgent care. We obviously did not want to walk into an emergency room, so we really wanted to get into an urgent care. And I called, and of course it was a Sunday evening. It's 5:15 at night. They close at 5:30. So we had 15 minutes to get him there. And I was really hoping for some reassurance from the urgent care person who I was talking to on the other line to tell me, what safety precautions should we expect?
Right.
I asked if he should be wearing his mask. And, they were like, no, he doesn't have to wear a mask. I'm like, no, he's going to wear a mask.
Right.
And I was hoping too, as I sent him out the door to get there before 5:30 when they closed, I was hoping that they were going to take his name and insurance card and things like that and information from me over the phone so he wouldn't have to do it when he got there. And they didn't do that. So I did not have that reassurance that I think a lot of patients really need right now. That reassurance is absolutely key.
Yeah, absolutely. Critical right now.
Yes. So, Ryan, do you have the presentation up there?
I do. Mm-hmm.
Oh, okay. I must be doing something wrong because I don't see it.
Yeah, it's good. We're live. Yeah.
Okay. And the actual PowerPoint is up? Anybody want to leave me a quick look? Oh, there it is. Yay. Okay, good.
Tired of seeing our faces, right?
I thought for sure it was me. All right, very good. So just a little background, as I was saying, I was fearful for my husband walking into an urgent care, and that's what patients are feeling right now. They're fearful, they're anxious, they're uncertain. So really right now, restarting a practice among COVID-19 is going to require a strategic approach to patient communication that is detailed, reassuring, and drives operational excellence. So that patient communication aspect is absolutely vital to help restart and ease patients' concerns so that they can walk in the door feeling comfortable and knowing exactly what to expect when they're walking in the door.
Yep.
So our goal for this webinar is really to help practices achieve a successful restart. And, I say restart kind of sounds again like that switch that you're going to flip on the wall and everything's going to be back to normal. When I say restart here, I'm really kind of saying we're going to have to continue to consistently provide this patient communication over time. And it could be, upwards of a year or two. So we really want to help practices achieve a successful restart by delivering an effective patient communication plan. So we're going to look at what information is absolutely key to communicate with your patients. What do they absolutely need to know? We'll talk about best practices for patient communication across all of your marketing channels. So the more information that you can get out to your patients, the better, right? And then finally, we'll provide this little bonus. You'll receive a free patient communication plan that can be edited specifically for your practice. So you can tailor it, and that will be emailed out to you later today. I think it's in an Excel spreadsheet, right? So it can be specifically tailored for each practice.
That's right. That's right.
Okay. Very good.
Great. Well, like everyone here, we believe the most critical part is the patient experience, and the underlying component of the patient experience, a big piece of that, as Jill mentioned, is having a patient communication plan. So today we're going to walk through really kind of two different components. The first component is what should we be messaging? So what are those key messages? It's going to start with 3 key questions. And then we're going to take each one of those, once we have our key messages, and we're going to go through each one of these communication channels. You'll hear me say communication channels and marketing channels interchangeably today. But we'll start with your website, and we'll go all the way to scheduling, which obviously all very critical aspects of each and everyone's practice today. For those of you taking notes, keep in mind after the webinar today, we will send out the editable patient communication plan. As Jill mentioned, you can completely edit that. And this is a framework. So there's information in here that is completely adjustable. We did use, obviously, ophthalmology as kind of the case study as we go through this today. But again, you can tailor it to meet your particular practice's needs.
Yep.
The first piece of this, again, is what are those 3 key questions? So as a patient communication plan, it serves as a roadmap for your entire practice to communicate. And patients, they need to know what patients are you seeing. And I know that kind of sounds funny, but I'm in a place where, stay at home still in place, but slowly they're phasing it out. And I'm even scratching my head on what's open, what's not open. So again, very simply, what patients are we seeing is question number 1. The second piece is what can you expect when coming to our practice? So setting that patient's expectation. Your practice may be the first healthcare experience they've had since a stay-at-home order. So keep that in mind. It's going to be brand new for a lot of people. And then lastly, what extra steps are in place to keep all of us safe? So again, patients, expectations, safety. We're going to talk through editable answers of each of these coming up on the following slides here. First one to jump in, what patients are we seeing? So we've broken down this first question into really 2 answers, 1A and 1B, and 1A being for the practices that are currently still at a stay-at-home order. And again, using ABC Eye Care is seeing emergency and pain patients only. You'll need to call the office. I know that sounds very simple, but it's very key right now. Any type of statement from your local academy, potential governmental agency, right there we have an example of the AAO, and then telemedicine. So are you offering telemedicine? If so, how do they take advantage of that offering? And the last piece, the COVID-19 exposure. As you transition, because we're all going to transition, right? It's not a question of yeah, for sure. No, we are. It's not a question of if we're open. It's more of a question of when we're going to be open. So as we transition, we're going to transition into 1B, and it's going to be as of a certain date, right? And it might be phased approaches too, depending on your local area, but as of May 11th, ABC Eye Care is seeing all patients. So reinforcing that, letting them know to contact you. Telemedicine, keep that in there. It's up to you, but it's a great opportunity, again, to also provide the experience via telemedicine, but reassuring the patient the steps that you've put in place for safety, right? So when they do, if they're uncertain and they don't want to come in, but they do want to take advantage of telemedicine, you can also use that call to let them know what you're doing in the practice to drive them in the next time they need your services. And then lastly, the COVID-19 exposure there. Good. So that's really quickly the what patients are we seeing? As we go to question number 2, what can you expect when coming to our practice? So the biggest component here is setting that patient's expectation. Again, the new normal. This could, again, keep in mind, be their first experience out with the healthcare provider.
Yeah.
And we've broken it down into sections. And the first piece there is mask. So mask or no mask. Second piece is screening. Jill, we had a question yesterday about the temperature, and again, this is editable, right? So it just says 99 as a placeholder. You need to plug in, the appropriate temperature there. Waiting room. Are you asking patients to stay in their car? Are they coming into the waiting room? That is a key piece to set their expectation. Updated visitor and companion policy. So are you limiting how many people, how many guests? We all know everyone loves to, bring a lot of people to their appointments, but what are those specifics and communicating that up front?
Absolutely. And I think so many of these things are going to be very different among each practice. It could be dependent on state. It could be dependent on, what type of practice it is, what the business model is. And it could depend just on the logistics of where the parking lot is compared to the office and how large the office is to keep everybody at a distance. So I think there's a lot of different factors that have to be played here for each individual office.
Yeah, that's right. I mean, and the key is, using this as a framework to adjust it to meet your particular practice's need from a communication perspective. But this is the information patients are seeking, right? So they want to know what to expect, and you can tailor it appropriately.
Absolutely. And I would also add too that, we're talking about patient communication here, but you've got to also make sure that your staff is fully aware of all of these new rules and regulations as well, so that there's no confusion when they're communicating with patients.
Yeah, great point, Jill. One of the things in the editable communication plan that everyone will receive at the end today is, there's a third step, and that third step is, consistently reviewing the patient communication plan with your staff. So great point. Great point. Okay. The third key question, and there's a subtle nuance here, is what extra steps are in place to keep all of us safe? And I think that's important, the all of us safe, right? Patients oftentimes have the perspective to think of, them and only them. But guess what? The doctors, the staff, every practice is trying to keep everyone safe. And so it's not just what extra steps are in place to keep you safe. It's really all of us as we're in it together. A great statement there at the beginning, letting them know your safety, along with the safety of all of our staff and doctors, is our number one priority. The next piece there is infection prevention precautions. This is a pretty thorough answer. Again, you want to customize it based on what you have done at your particular practice. Great example. We've removed all shared items like magazines. That's another key piece in there.
Even toys and pamphlets and things like that. Everything's got to be cleared away. Yeah.
Yeah, the next piece, check-in procedure. So there's some answers there again about clipboards are cleaned at check-in. You'll receive a pen that you may be able to keep to fill out your paperwork, and then online patient intake forms. So a great opportunity to send those in advance, post them to your website. Give the opportunity to the patient to fill that out prior to. And my wife had continuously been pushing off a reoccurring appointment during this time frame, and finally ended up going to it. And again, mask was there. There was screening. She tried to fill the paperwork out online in advance. It wasn't an option. But one of the things that they did was, as she filled out the paperwork, she gave it back to them. They said, "Look, keep the pen." Yeah. And again, it was just a subtle gesture to keep the pen, but it really reinforced the level of detail that this particular practice had taken in ensuring that they've kind of thought through every type of scenario from a patient perspective.
Probably made her feel a lot more comfortable.
Absolutely. Absolutely. So those are your three key questions. And again, you have to develop your three key messages. This is a framework to help you create those three key messages. The rest of the presentation, we'll talk about best practices for communicating those three key messages throughout all of your marketing and communication channels. The first one up is website. And I saw our local MGMA sent out a note that 72% of practices would be communicating the majority of COVID information via website. And we've got some examples in here on the next couple slides as well of some websites that you'll see. But communicating those 3 questions on your website with specific answers, including a date. So as patients start to get back in the community, as they start to get out and about, they're going to want to know, when was the last time this was updated? And so that's something to keep in mind, to always update your COVID-19 page. And again, this is a dedicated COVID-19 page on your website. It's not the homepage. And I think that's something for all of us to keep in mind. That's very important. This is not something that's going to be done in a month, 2 months, 3 months, 4 months. We don't know the time frame, right? Mm-hmm. So by having a dedicated page, you allow that additional flexibility over time to make easy updates. So you're making one update to a website that then you're driving all of your additional communication channels back to. So really making your life a lot easier. The last piece, the alert header, we'll talk about in a second. As you can see, there's a COVID-19 example page here. This is one. We'll start here with an alert header at the top. And what this does is it allows you to communicate important patient updates at the top of your website. And that would be static. So it'd be on every page of your website, you'd see that header. I think that's an important note.
So I like the idea of having, some sort of a header that's like part of the website that patients can click on to take a look. I've been to a few websites now where I've seen kind of this big white box that pops up and it covers up the entire, front page of the website. I mean, it might as well be kind of a skull and bones saying, "We are closed, don't come in." It's a little bit intimidating and scary. And so I think the messaging needs to change, and we need to have this information about safety, but it's got to be a little more welcoming. So I like the idea that there's kind of a header that patients will click on to get more information. So it's part of the website as opposed to, something covering up the website, if that makes sense.
Yeah, absolutely. Great point. And the other key with the alert header is, there's a lot of sites that I've been on that have pop-up messages, and the normal user experience is to just X out of those. And you have to keep in mind 60 to 70% of your traffic is going to be on your mobile device. So what does that pop-up look like on a mobile device, an iPhone, et cetera? Probably doesn't look so great. So that's the benefit of, having a dedicated alert header at the top of your page that then drives to a dedicated COVID-19 page. And then the rest of it, literally list the 3 questions at the top. Let them know those 3 questions, and then down below you answer each one of those 3 questions. Here's a great example of another practice with alert header. They've added a nice touch that says, "We're seeing patients." I'd love for the second piece of this to be updated to important patient updates versus important information. Information just really doesn't get the patient's attention, but the red definitely does. So, they've accented this with a nice red color to make it pop. And again, it drives to a dedicated landing page where they can communicate all of their COVID information.
And I like the words that they're using too. "We're back." The other words that I'm seeing quite a bit lately is "we are open." I just got something from my dentist on that. So I think, the more inviting the words, the more that patients are going to take a look at and look at the safety precautions. But I think, "we're back, we're open." We've got to get patients feeling confident in coming back, as opposed to, the skull and bones saying "we're closed."
That's right. 100%.
Oh, and I did want to mention real quick, Anne had mentioned you may wish to provide masks to all patients because doctors may need to touch the patient's face, and patient's own mask is sometimes unknown. So, if practices can get a hold of masks and be able to provide that to every patient, that's more ideal. So Great comment, Anne.
Yeah, great point, Anne. As we move from website, we talk about email. So, Jill, how many emails have you received related to COVID?
I think in the initial weeks, I probably was getting at least a dozen or 2 per day on COVID. It was a little overwhelming.
Yeah, 100%. I think every major, big brand, Fortune 100 sent out. I know one day, a couple weeks ago, I got emails consecutively from American, JetBlue, Delta, and Southwest all in the same day.
Yeah.
about everyone's commitment to safety. So there was a great reinforcement there from
Yeah.
the airlines all at one time. But a couple things on email. First one being, what's your one thing? And so we say, obviously, your email is going to communicate more than one thing, but that second bullet there is just a great example of how to develop your one thing. Don't write in the email the purpose of this email is, but think about it from that context. The purpose of this email is we're open, right?
Mm-hmm.
We're seeing new patients. We're seeing patients, and then couple that with question number 2. So the question number 2, key message number 2, what can they expect?
Mm-hmm.
And then driving a link back to, you can put a note in there about your commitment to safety, and then drive that back to your COVID-19 dedicated page. Because guess what it's going to do? It's going to tell the patient again when they go back there, what can they expect, your safety measures. So again, reinforcing that communication via email is key, making it do the heavy lifting for you, but not making it too much to read.
And I think patients are more likely to open it when it's coming from their doctor, their personal doctor, as opposed to a large company, like United or American or Delta or something like that. They're more likely to read it as long as it's nice and simple. Yeah,
and I would even say, the other piece of this, the second to last bullet there, adding the personalization. So the personalization of the doctors, from Dr. Timothy Kisla, at the end, we're committed to safety is a great touch.
Yeah, that gets their attention.
The next piece here, social media. So, the one thing that I've seen, which has, I think, been a little bit fascinating, is a lot of people continue to have their same content flowing, and they haven't done an audit of their content queue. And again, it could be for various reasons, just trying to put Band-Aids in other places, but for the time being and how quickly this came out. But audit your content queue. So make sure you have relevant content. You're going to continue to use your 3 key questions, your 3 key messages. And everyone in social media knows the hardest part is coming up with content, right? But here's an easy way to do it. So think about, what can you expect when coming to our practice? And if you think about that question right there, you can break that down into 4 separate posts: mask, no mask; screening, no screening; your visitor companion policy; your waiting room procedures. Right there's 4 unique posts. And if you use those individually, they'll work a little harder for you, because keep in mind, only 5% of your posts on average are going to be viewed by your followers. So, it's not a big percentage of your followers that are going to see that. So break those up. That's a great tip to help share the message.
If you have 4 posts like that, should you be placing all 4 posts on the same day, or spread them out amongst a week or 2 weeks? What's the best way to kind of get that out?
Yeah, great point. I think the first key message obviously is going to be, for most places, look, we're back open, and here's who we're seeing, if there are any adjustments to hours, et cetera. But I would definitely recommend at a minimum posting 2 times a week, specifically just on Facebook itself. You may need to dial that up. I think one of the key things, that's a benefit as you continue to listen to patient feedback. Let's just say hypothetically, one of the biggest pain points, as we start to move forward, could be the companion policy, right? So it could be the fact that, hey, I've showed up, I've got 2 family members with me, they're not leaving, I want them in the building, and it becomes a pain point, and it becomes something that you realize you got to communicate and put more emphasis on. So you may need to readjust your entire social messaging plan, and you may need to post once a week just about your visitor companion policy based on the patient feedback. So, a good rule of thumb is, 2 to 3 times a week, but definitely, listen to that patient feedback and then use that to tailor your message accordingly.
Yeah. The other thing I've seen work really well on Facebook is just those personal videos from a physician who's walking through the office, showing patients what to expect as they come in.
Yeah.
What they have to do as soon as they walk in the door. If they have to get hand sanitizer, they have to make sure their mask is on,
That's right.
How they register, and, what it looks like walking into an examination lane.
That's right. That's a great example. And, the iPhone takes an amazing movie these days, and you drop it into iMovie and you can edit that pretty simply. Very low cost solution to really be authentic, right? You're authentic, you're relatable. This is unfolding real time. It doesn't have to be a high end production to let your patients know that you care.
Yeah, and it puts everybody at ease when they can see a video like that. Absolutely.
Yeah.
So just a little reminder, since we're about halfway through, if you have a great idea you want to share, some way that you're staying connected with your patients, whether you're posting things on Facebook, or if you're personally calling them, if there's any unique ways that you're doing that, or you might just have this idea in your head that in the last 8 weeks you haven't had time to get to, but you have this great idea that you want to do to stay connected with your patients, feel free to post that on there, and we'll be randomly picking somebody at the end for a $100 Amazon gift card. So just wanted to throw that idea out there.
Yep, that's great. Yeah, let's see some ideas. Somebody wants a $100 Amazon gift card. I know there's a lot of creative people on the call today, so thank you guys for joining. Google My Business, the 800-pound gorilla, the place that gets more traffic than your actual website is your Google My Business listing. Again, that's got your online reviews. It's got a link to click on your website. It's got a link to follow directions, and it has a link to call. So a couple things here. They've rolled out this COVID-19 message update. It's a static message. Think of it in terms of putting a billboard outside your practice, except many more people are going to see this. Definitely recommend you update this. A great example, don't put your phone number in here. They're going to reject phone numbers. It makes sense because your phone number is already on your Google My Business listing. But, great. Hey, we're open. We're seeing patients. Visit our website to see what can you expect when you come to see us. Those are two key messages that this Google My Business listing update could support for you.
I think this is huge because I don't think anybody really knows about this. And I think this is really important because if you go to Google My Business on different businesses' sites now, the information's not always accurate in terms of the hours of operation or, little bits of information. You don't know if it's accurate or not. So I find myself going to Google My Business and calling these businesses to find out answers to the questions that I have. So I think it's kind of nice to be able to actually have the business post something in there saying, yes, we're open now, please call, make an appointment, whatever the case may be. It's a great tool, and it's free. It's free to do. It takes 2 seconds, right?
Yep, absolutely. And great point. I mean, I think oftentimes, one of the things that's overlooked is call volume, right? So, people are calling you to ask you basic questions, which could be answered, on your COVID-19 page or on your Google My Business listing. So, while it does seem like, potentially a lot of work to update some of these places, if you start with that key, consistent patient communication plan, disseminate that across all your channels, it'll help you tremendously.
Yeah, absolutely. Good.
The next part here, Jill, I want to include this. We did a study of negative online reviews, and I know you've got some to add, and it was specific to ophthalmology, but there were two. We basically pulled in hundreds of thousands of online reviews that were just negative, literally just negative reviews. We hooked up our feeds, we pulled them in through Google, Facebook, and Health Grades, and we did a study of what are these negative reviews saying. And the number one piece of patient feedback was wait time.
Yep. We've done so many patient satisfaction surveys over the years. Wait time is always the number one patient complaint. I've never really seen it as anything else. But I think the biggest concern now, based on everything that's going on, is I think that wait time for the first time in history might actually get replaced by safety issues or concerns that patients have. So I think this is why negative online reviews or any online reviews, I think, are so important to focus on right now, because patients, if they're not being communicated well to and they're not sure about the safety when they're walking in the door, or they notice something is wrong, guess what? They're going to go online and they're going to post a negative review, and it's all going to be about safety concerns. So I'm a little bit concerned that wait time is actually going to get replaced, for the first time in history with safety. So that's why I think this patient communication is so important.
Yeah, I think it'll be interesting to see where the data comes out.
Yeah.
And the second point here is, I've had this conversation with a lot of docs, it's did not receive a thorough exam. And the underlying piece of this and the insights isn't always, that they didn't receive a thorough exam. It's that they didn't receive communication from the tech, from the doctor. And that actually played the part into why they didn't receive a thorough exam. So clinically, they had a good exam, but the communication with the exam, walking through the steps and the procedure, et cetera, with the patient made them feel like they didn't have an exam. So point of that being is patient communication just being such an integral part of this whole piece here.
It's funny, whenever I'm doing customer service training, patient communication is always the number one thing that you really need to be doing and focusing on. But it's funny, it's even more important today than it was, just 8 weeks ago. It's crazy.
Yeah, it is. And we're going to talk about scheduling coming up here next, or in 2 slides. They've got a big job, right? So, you want to again continue to deliver an amazing patient experience. Set those expectations because it's going to directly tie into your patient and physician referrals. And specifically talking about physician referrals first. Use this time to reach back out if you have referring physicians who are sending patients to you. And recommunicate your core services. Let them know. And again, in this example, let them know you're back doing cataract surgery, you're back doing LASIK, and let them know again, look, hey, here's what your patients can expect when they come to our practice. Here's a link to our website that shows these additional steps. But use this as an opportunity to recommunicate to your physician referrals. You don't want your patients going back to those physicians who refer you business and say, look, I didn't have a good experience. Here's what happened. They didn't tell me about, the safety procedures and what I could expect prior to.
Yeah, absolutely. And I think, the email that you send out to patients is pretty much the same email that you're probably going to be sending to your referring physicians as well. I've also heard of some practices that are really taking advantage of this time and doing Zoom meetings with their referring physicians, just talking about what safety precautions they're putting into their office, educating them on things that they might be doing a little bit differently. And that's a great way to stay connected with those referring physicians because it doesn't cost a thing. And it's really easy to schedule something like that. So to be able to get those referring physicians on a Zoom meeting is really quick and simple to do.
Yep. Yeah, absolutely. And, as you transition over to the patient referral component, reinforcing your safety commitment to them, letting them know, communicating your core services in a potential brochure could be an opportunity for you. Set it at the counter at checkout, let them pick it up. And that could be an opportunity for you as well, because we're going to continue to, hey, Jill, have you been to, your ophthalmologist lately? And it's Jill's like, yeah, it was great. I had a great experience. Here's what you could expect. And, my experience may be, well, I'm not sure if, the provider I go to is buttoned up or not. So that's a little bit of role playing, but that's how that could go. Absolutely.
Good.
The, one of the biggest pieces and the toughest jobs any practice is scheduling. And there's already a laundry list of things that need to be communicated to the patient in advance of their appointment. A lot of scheduling right now, you may be bringing your staff back in a phased approach, right? So during the time when they're rebooking appointments that have been pushed out, they're going to get a lot of questions. They're probably going to get a lot of questions, around safety, right? And you also need to be setting that expectation on what they can expect when coming. So you may not have the bandwidth to go into a 20-minute conversation as you've got, 10 calls on hold and reduce staff about the additional safety steps you've put in place. So again, great opportunity to drive them back to your COVID-19 website to learn more. Not saying not to talk about it, just saying, you can give them a little bit of information, send them there for more, but really focusing here on what they can expect when coming in.
Mm-hmm. Absolutely. And I think that checklist obviously needs to be a little more robust than just those 3 items.
Yeah, absolutely. It's, use a checklist. That's the key here is, there's a lot to remember. A checklist is a great tool to be able to remember those key things, and then a script too. So we're big fans of script. Give them exactly what you want them to say. And again, this patient communication plan, as you fill it out, that can be the script. So keep that in mind.
And the other thing I was going to mention, that script might be changing. So you might have to revisit that script on a weekly basis just to make sure that the message is still accurate and consistent, right? Things are going to be different, a month from now or 2 months from now. We really don't know what's going to happen. So I think that script is really vital.
Yeah. A great point, Jill. Great point. Other communications to patients. This is a little bit of the kitchen sink, but the key takeaway here is really think about your one thing as it goes across each one of these touch points. And what I mean by that, a great example is if you have a waiting room TV solution that's serving messaging to your patients and you are having them in the waiting room at this time, you want them, you'd want to recommunicate a lot of your safety messages, right? They're already there, so they already know what patients you're seeing, but you'd want to recommunicate your safety measures. On hold messaging, I think that's one that's forgotten about, right? Yeah. So I've called several practices recently, and it's the same old, on hold message. There's no deviation from what's been communicated earlier, and that's a great opportunity to, again, let them know what they can expect, let them know what patients you're seeing, and then let them know what safety measures are in place.
And I think if it's the same old on hold message, you kind of wonder if they're really open, if anything has changed. So yeah, I think that's an important one to remember.
Yep. The last thing here I'd say on this slide, Jill, is just, by having a dedicated COVID-19 page versus a pop-up or a different type of execution on your website, it allows you the flexibility to drive all your digital communications back there. So if you're sending text message, for example, letting them know we're open, learn more here at this link, it's an easy way to drive those digital communications back.
Yep, absolutely.
The last piece of this is your patient communication plan by channel. So at the end of the webinar today, everyone will receive the patient communication plan. It will be in a Word document. You'll be able to go through each one of the 3 questions to develop your 3 key messages. You obviously cannot see this slide because it is an eye chart.
It will be bigger, right?
Yeah. You have no problem seeing it when it's sent through. But then the last piece of this is the communication by channel checklist. So you go through that. It's a very simple document that says, do we have a waiting room TV? Yes, no. Okay, no, we don't have it, so we don't need to worry about that. But you know what? We do have referring physicians. And so we want to develop an email to referring physicians. Here's what we're going to say to them. It's a combination of who are we seeing? Yes, we're open. And what can they expect? So again, it's a guide. All of this is editable. It's a framework. But that's what you get for coming to the webinar today.
Excellent.
Great.
Are there any questions on your end that you've received?
No, I see the, there's a couple ideas that have, looks like Debbie Dent Kleinfelter has a suggestion there, if you can see.
Yep, we divide our doctors up on certain days. So there's only one doctor in the office at one time, and we only see about 10 to 15 patients in the morning only. And that's what we're seeing pretty commonly in all the practices. Some practices are actually starting to kind of expand their days. So they're actually going into the evenings and sometimes onto the weekends as well, just to keep everybody at a distance and to be able to get all those patients in with just one or, maybe 2 physicians in at any one time.
Yep. Great. Well, Jill, do you want to select a winner here?
Well, I don't know if did we get any ideas in?
I see Debbie, and then looks like we've got one more back here on a piece of feedback from Ann Bidwell about providing masks.
Oh, yeah. You know what? How about Ann Bidwell as the winner for today?
And congratulations, $100 Amazon gift card coming your way.
We'll send that via email. You'll get that, and I'm sure you will use it wisely. We just ordered what was skateboards for our kids, so on Amazon. The things you can get, it's amazing.
That's it. Yeah,
so we'll make sure that we get that out. Awesome. Any final words, Ryan?
No, I'd just like to say, thank you everyone for taking the time to join us today. And again, you'll receive this emailed out after the webinar today. But thank you so much for taking the time. I hope you guys found this as a valuable experience today. And again, enjoy your upcoming weekend. And thank you so much.
Yeah, and if for some reason somebody had a question and we did not answer it, please don't hesitate to reach out to Ryan or myself. We're happy to answer any questions that you might have. Certainly take care of yourselves and be safe, especially as practices are starting to open up again. And we really hope to see you all real soon.
Thank you.
All right, thanks. Bye-bye. Have a great day.